I'd recognised very quickly that we needed to get messaging to patients and indeed staff. So we've got different messages within different parts of the hospital. So right through the hospital we've got staff messages that are very clear, very punchy. The system obviously works with our wait times, and this is very important, particularly because we know that people come to the emergency department for primary care type conditions. So actually by announcing, there's a 4-hour wait, or indeed there's a 6-hour wait, some patients or their families may indeed be able to say, well, think about actually going to 111 or whatever. So we have a huge footfall through both hospitals, people coming to appointments physically, and actually we've realised, like a number of hospitals across the country, we don't need to do that. We can actually do outpatient appointment through video or telephone consultation. So for example, messaging around that will be really important. And what I have liked as well is if I've wanted things changed quickly, maybe a message or indeed some of the background music, again, the company's been very good at kind of responding very quickly to that. I've been able to contact the company very, very quickly and say ABC, and literally by the afternoon it's on and it's been broadcast. And a number of the exec team have also spoken to me and said that they found this is one of a really set of effective measures to get that information out. So that's the key for me, is not having to wait. If I need a message on, I need it on quickly, and that's what's made the difference really.
Yeah, so our interest in Audiebant tannoy system was that we wanted to instill something that was really going to be a real-time messaging platform for us, being able to inform our patients and also our staff about sort of the key messages that we wanted to get over to them. And we thought from a patient experience perspective this would be something that would be really good, and also from a staff experience perspective as well. And it's been a great success actually. Thankfully we got it implemented in quick time within our ED department, within our main entrance as well, and also in the back entrance of the hospital too. It became quite clear that we needed to change the messaging as time went on, particularly within the COVID situation, to something a bit more bespoke, changes here and there, as obviously the national guidance has changed. And again, we were able to do that in really quick time, so that was absolutely brilliant, in be able to, in real time, be able to change those messagings accordingly. And now what we're looking to do is to get something a bit more bespoke with regards to executives being able to say their own message with their own voices over the tannoy system, which again is a brilliant piece to do. It's definitely here to stay for us, and we would like to, at the moment it's in key places, but we'd like to roll it out across the trust. I think it has shown its utility without a shadow of a doubt. Just having that music there is really sort of, from an atmosphere perspective, has really sort of lightened it up, and also again it's helping people just to reduce that anxiety, because coming to hospital isn't, it's not a nice experience for most people, and so actually being able to reduce that anxiety is a great thing. So that has been very welcomed actually.
I'm here to talk to you today about an announcement system called Audiebant, which we have been trialling in our practice since last summer. One of the reasons that we've been using this particular form of communication with patients is that we found whilst people were waiting in the practice, they were actually not watching or looking at any of the health promotional information that we had to display. And that's partly because now, as now is common, people are often distracted by their mobile devices or other things that they are doing. So when we trialled this out, we were very keen to provide messaging which was on the point, talked to people in a timely way, and gave some important health information in a way that they could digest in bite-sized chunks. And it's probably more timely now than ever that this type of information is available in bite-sized chunks and is, as I said earlier, accessible to people in that format.